Tonight, a proposal is moving through Frankfort to draw more healthcare workers to the state by protecting them from procedures that would violate their conscience.
Capitol reporter Bodie Brooks has more on the debate.
There are physicians who already make those kinds of decisions, but they're not protected when they do it. And then they get threatened with their jobs.
Senator Donald Douglas is also a medical doctor and says his 3 kids pursuing the same career are choosing not to practice in Kentucky. Among the reasons why, he says a lack of legal protections for not doing procedures that they may morally object to.
I have supervised physicians my entire life. I've never, ever had a physician come up to me and say, I can't do this, and they're making me do it.
Senator Karen Berg, who also has a medical background, says there are existing protections already for healthcare workers who refuse to treat patients who are aggressive or believe a treatment may do more harm than good.
What does this do to change that?
I've seen a number of my colleagues who, even though the practice standards you cite might be something that is written, it is not something that is followed.
Douglas says he has medical colleagues who have been threatened with losing a position or job, and this bill would treat that as discrimination.
Would it be possible for a healthcare physician to say, I'm not going to treat a veteran because I have a moral objection to the war they served in? Or for a nurse to say, I'm not providing prenatal care to someone who conceived through IVF?
This language allows physicians to be treated like everyone else is treated. Now, we can read into that whatever we want.
Douglas did not give specific examples of how the bill would affect a healthcare scenario. Federal law would still require treatment during an emergency, regardless of conscience. Bodie Brooks, Fox 56 News.
The bill passed committee on party lines. It now heads to the full Senate for a vote.